Good morning, Australia. Buenas tardes, boa tarde, America Latina. My name's Noel Campbell. I'm the co-director of the Australian National Centre for Latin American Studies, ANCLAS, here at the Australian National University. It's my pleasure to host this webinar on public health and policy impact of COVID-19 in Latin America 1 year later. And in so doing, I'd also like to recognise the collaboration of my colleagues, Salvador Carulla from the College of Health and Medicine at ANU, Gisselle Gallego from the School of Medicine at the University of Notre, and Claire Palmer from the College of Arts and Social Sciences here at the ANU. The organisation of the webinar has been very much a joint effort. In accordance with the custom here at the ANU, let me begin by acknowledging and celebrating the first Australians on whose lands the university operates, and paying our respects to the elders of the Ngambri and Ngunnawal people, past, present, and emergent. The objective of this webinar is to review the response of governments in 3 Latin American countries, Brazil, Chile and Uruguay, over the past year to deal with COVID-19, and also to consider what lessons can be learned from the experience. It follows a series of 5 webinars we held in November, which looked at the same theme, but before the emergence of the Delta variant and before the rollout of vaccines. The program today will consist of 4 main parts. First, a brief introduction by myself to refresh our memories of the main outcomes of the sessions last year. Second, presentations by our 3 guest speakers, Denise Razuk from Brazil, Emilio Santelices from Chile, and José Pedro Arcos from Uruguay. Third, a period of questions and answers with the 3 speakers to be moderated by Salvador Carulla, and finally some concluding remarks by Gisselle Gallego. I should mention at this point a couple of housekeeping matters. Please note that the webinar will be recorded and eventually made available publicly. For the question and answer session, the intention is to encourage discussion, drawing on questions we invite you to submit using the chat function at the foot of your screen. If you need to contact any of us during the session, please use the same chat facility to send a private message. But before passing the floor to the first speaker, let me provide a very brief summary of the main points made by experts from Brazil, Chile and Uruguay last November on the impact of and policy responses to COVID at that time. The experts began by giving an overview of the characteristics of the health system in their respective countries. Clearly, there were certain similarities. Health spending as a percentage of GDP was similar in each of the 3 countries, about 8 to 9%. Each of them also had a mix of public and private healthcare services, and each had a large number of workers in the informal sector, especially Brazil and Chile. But there are also a number of important differences between them. The scale of the challenge is obviously more daunting in a country like Brazil with a population of 210 million, compared with Chile, which has 19.5 million, and Uruguay with 3.35 million. There are also demographic differences. Brazil has a large youth population, whereas Uruguay has the phenomenon of an aging population, one of the groups most vulnerable to COVID. The capacity of health infrastructure and health professionals also varies considerably. The number of doctors per 1,000 people in Brazil and Chile is around 2 to 2.5, whereas there are 5 per 1,000 people in Uruguay. So the obvious conclusion was that there can be no one-size-fits-all approach to dealing with the pandemic. So how did governments react? What were the main health policy actions they took? Brazil was a standout with what became known as the so what policy. You may recall that when asked about the impact of COVID, The president initially dismissed it, saying, "It's nothing, it's a mild cold." And when pressed later, he said, "So what? What do you want me to do?" In Chile and Uruguay, and to be fair, at the state and government level in Brazil, governments did acknowledge the reality of the pandemic and intervened with a range of mitigation and containment measures, from closure of borders to an increase in testing to local area quarantines and lockdowns. Obviously, some aspects of the response worked better than others. Let me refer to a couple of examples that the experts cited as being positive. In all three countries, increases in funding, the health sector, were made to strengthen capacity. In Chile and Uruguay, there was close cooperation between public and private hospitals to maximize the availability of beds. The shortages of global supplies encouraged local solutions in many cases. In Brazil, for example, the manufacture of inexpensive ventilators, and in Uruguay, it was an incentive for the development of testing kits, local testing kits. On the other hand, with the benefit of hindsight, the experts said that there were clearly aspects of responses by governments that should be improved. The need to better align economic and health measures, for example, the inadequacy of testing capability, the lack of capacity, initially at least, to track and trace the spread of COVID, and the inconsistency of messaging. Looking to the future, the three experts identified some lessons learned from the experiences of managing COVID in their respective countries. The importance of having an integrated national policy, the need to act early, swiftly, and decisively, the need to invest in medical research and technology, the priority attached to caring and protecting health workers, and the need for clear and consistent messaging between and within governments, as well as the need to have in place a framework to manage access to and distribution of a vaccine when it became available. So what has happened in the last 12 months since the experts from Brazil, Chile, and Uruguay made those observations? To help answer that question, let me now introduce the first speaker. The first speaker then will be Denise Razuk, the affiliate professor in the Department of Psychiatry at the Universidade Federal de São Paulo, where she coordinates the Center for Medical Health Economics. Denise will share the experience in Brazil of dealing with COVID over the past year. Denise, the floor is yours.
Sorry about the time, because I was thinking about 8 o'clock, not 7 o'clock. I just calculate wrong with the time. Thank you very much for this invitation to be here. I'm going to share my presentation. A second. Sorry about that. It's okay, can you see?
Yes.
Thank you.
It's okay.
Okay, let's go to Brazil part. As you can see in this table, we can compare the number of cases and deaths between the end of 2020 and now. And still, Brazil is the third country in the world with the more cases of infected by COVID. and this is about 10% of the world case and half of Latin America case. But the worst scenario is about the death, and we are the second country in the world with the biggest number of deaths, and this is very important in terms of 12% of all deaths in the world is in Brazil, and this is represent 40% of Latin America country deaths. So that at least 80% of people deaths could be avoided if policies were better oriented. There's something not good. Okay. Here is our graphic about our two waves. The last year we have one wave in the beginning of the year, about April, and then we had a second wave starting in the beginning of the year, but the worst moment was in March and April. And we had a remarkable mark, and very sadly mark, of 4,000 people dying a day in the second wave, and compared to the first, the worst moment of the first wave, it was a very big difference. And here we see the mortality, especially of people with older than 60 years old and people with comorbidity. And here the profile was different, it was younger people and not necessarily with comorbidity. And what is interesting here is that our vaccination rate started to be especially efficient after July, because we started very slowly, only on the vulnerable groups here, very, very slowly. And when you reached 25% of fully vaccinated people, we started to see a big decrease on the mortality rate. Now we have 80% of adult population fully vaccinated, or almost half of population in Brazil. And we have now Oxford, AstraZeneca, Sinovac, Pfizer, and Janssen. But at the beginning, the vaccination process started with Sinovac, especially for the older people, and then started the production of IFA here in Brazil. And the production started in Sinovac in Brazil also. But you only have a good speed after July of this year, and now we are able to vaccinate 2.5 million people a day. Our current scenario now is really better than it was, and people are, the vulnerable people are almost completely vaccinated, 80% of indigenous, and the people older than 60 years is fully vaccinated too. And we started the third dose because they received the Sinovac and the mortality rate started to increase again. Then the third dose was necessary in this group. And vaccination also started among adolescents on September. We see also a decrease, a remarkable decrease on COVID occupancy rates, beds. And as you can see in this map, was in July. As you can see in the central region, the red color is the intensive care beds was occupied over than 80%, and on yellow is about between 60% and 80%, and on green is less than 60%. As you can see in the July 2020, the central region was yet in the first wave, and then this scenario was changing. It was better in the end of the year, but Amazonas this is the north of Brazil. Amazonas started their second wave on the end of 2020. And as you can see, very rapidly it spread to the whole country. And then in March and April, we started in a very, very bad scenario, as you can see here. We saw some municipalities with much over than 100% of bed occupied. And it was a disaster, catastrophic, lack of oxygen supply, lack of respirator, lack of beds. It was completely chaotic scenario. It was very sad. And now we are totally in green. This means that 30% of beds are occupied. In terms of economic and health policies, the most important thing was a vaccine purchase. And now we have a new good news that we developed a new vaccine in Brazil, and it's being tested in clinical trial in humans since this semester. And if it goes well, the big advantage is very cheap. About constraint measures, we have a very heterogeneity among states. Every state took their actions about how to apply constraint measures. Then we see some lockdown in some regionals, but most of time are some restrictions about the period of time that stores can be open, etc. But until July, everything was online. And most of, we can purchase things only by internet. It was applied a federal law that everybody must wear masks. And if you don't use, there is a fine. Also, we started to see some kind of flexibilization constraints measures since June and July, and the implementation of health protocols in supermarkets, stores, and restaurants, etc. And vaccination passport is still in discussion, but probably we have a need of some negative tests to go to places. For example, for universities, it's necessary, into schools, it's necessary to make tests. And test was not so massive as should be. And what we see, it was a different protocols to vaccine delivery and different protocols between the federal recommendations and the states. Everyone has done different things. Also, we implemented sanitary barriers in airports, especially when Delta variant arrives in Brazil at the end of August. Delta variant didn't make a lot of effect, probably because the vaccination. And now we have a lot of different experiments for relaxing measures in events, because governors want to open everything to the carnival, and they are testing how the infection behaves in this situation. In terms of economics, social benefit was cut on November last year, and then we started again on April, but with the half of amount of money, and the people are in very difficult now because this kind of amount didn't cover very basic food needs. Some support for jobs were renewed, and fiscal taxes, the reduction also. The big lessons were the problem was the coordination of actions, especially in terms of national plan. The timeline, the delay to purchase and to deliver the vaccines was very complicated. We could have a better scenario if this didn't happen. There was no alignment between economic and health policies. And the focus on vulnerable people, we have seen now increased number of people under the poverty line. This jumped from 13 million people last year to 27 million now, and the people are completely in bad situation, hunger. It's very complicated now. At least almost 6% of our population has some level of food insecurity now. And what the governors, federal, etc., are very happy because in terms of economics, our GDP has some signs of recovery in the first semester by increasing by 6.4%. This doesn't reflect the situation of our people because our Gini has increased, has worsened, and the sector, the service sector, for example, accounts for 70% of our GDP, and many sectors are not recovered yet. And many people, especially the vulnerable, are in the informal market. And then the situation of unemployment and poverty now and inequality is completely catastrophic now, and there is no social support enough for these people. Also, fake news, the press media, television making a big effort to combat fake news, and people didn't resist to vaccinate. In general, Brazilians go to vaccination every year. There is not a very problematic like the US. And another interesting finding that in public health system and compared with the private one, our public health system was very robust, very strong, and private service didn't deal very well with the pandemic. And some sectors, insurers especially, asked for public beds for them. That was an inversion. And another highlight is about our scientists and researchers and universities that engaged in a strong way and to generate information, to make research, to give information for the public, general public. Every day you have people discussing science in television and interviews, and this is very active, and innovation, etc. And still our main challenges are the problem of fake news, and our national policies is still complicated. Political dispute is influencing access to vaccine and good quality information. Failures on logistic and planning vaccine delivery. Corruption is still a big scandal yet. Social distance is a big challenge. We don't know if you are going to have a third wave next year. And now I think this one is the biggest problem and the main challenge for us. And tomorrow starts my vacation, and after 2 years without going to the beach, I hope can see the sea again. Thank you very much.
Thanks very much, Denise. It was interesting to see that some of the points you made resonate, I guess, with all of our countries. In the case of Australia, obviously the difficulty of dealing with a federal system, the debate about whether or not to have some sort of vaccination passport, and most importantly, looking at the economic consequences of the pandemic. But let's move on to our second speaker, Emilio Santelices. Emilio is uniquely well placed to comment on the role of the Chilean government in dealing with COVID. He was an advisor to the Chilean minister, and he was subsequently Minister for Health, a position he held until 2019. So Emilio, over to you.
Thank you, Noel. It's a pleasure to meet. Let me show my presentation. Good morning, everybody. I appreciate the invitation you have made me to tell you about the experience of our country after the turmoil produced by the COVID-19 pandemics. We have seen during this time how a simple microorganism has turned the planet upside down, not only stopping activity, but also causing economic loss of proportion of and forcing health system to be readjusted. That is precisely why we must take the shortcut that are offered to us and move faster, taking advantage of this moment when health appears at the first priority. Our focus was, in the first step, was to buy time while increase our testing capability in clinical bed. How I can show here, the problem with this virus was that we don't have responding the first time. So the main measure was the no mechanical measures, and another things is to increase the capacity of the health system. That's how our first focus during the first month. Regarding the country hospital capacity, Chile more than tripled its ICU beds through the advanced purchase of invasive mechanical ventilators. In addition, at the beginning of April 2020, the integrated COVID-19 network was created, incorporating the private beds in the public bed system. You can see here how we increase our capacity during at least 1 year. So the first lesson for us was the integration between the public and private sectors. That is very important to identify this issue because, how you know, there are very discussion, and especially in our countries, Latin America, how we include the private and public system all together, especially in this kind of the situation. The result is fantastic in terms of the response of the population. And in March 2020, Chile increased its laboratory network from 8 to 38. In this way, it's increased testing capacity from 2,000 to 11,000 daily PCR tests in order to isolate the contagious. That was very important issue for us. It was vital to be able to identify them in a timely manner. Today, Chile has more than 170 laboratories at maximum capacity of 90,000 daily PCR tests, and is the country is South America that has processed the last test, I will show here, per million inhabitants. Chile began to vaccinate on December 24, 2020. In this way, it became the first country in South America to begin the vaccination process against COVID-19. You can see here, sorry, but the screen not so clear, but the capacity, the vaccine purchased across the globe, Chile was one of the first country that's include this kind of strategy. Chile, Canada, and the United States and Uruguay are the only country in the America that will be achieve mass vaccination of their population during 2021. The rest of the country in the region will achieve the goal between 2022 or 2023. Chile began to vaccination March 24 between 8 and 22, 2021. And Chile was the country that vaccinated fastest in the world, managing to administer to average 300,000 daily doses, equivalent to more than 1.5% of the population. With 70% population vaccinated with two doses, Chile is today the 6th country in the world with the highest of the population vaccinated with the completely schedules. In addition, Chile early identified the need to administer a certain booster dose. Here I show you one publisher that we included in the last 2 months in Lancet, where we study near to 380,000 population in order to establish the kinetic of the vaccination and complete coverage. And different study allow us to know the behavior of the immunity of vaccinated patients, as shown in this graph and below. You can see the response with Pfizer, and the right side with the Sinovac. And finally, the Sinovac antibody began to decline around 20 weeks, and later decline seen for people with vaccinated with Pfizer. With this kind of study, we start early the program with for the booster. And August 11, 21, vaccination with booster dose began for the country's older adults. 3,246,000 booster dose has been administered in 50 campaign days. 70% of those over 70 were vaccinated with 2 doses of the COVID-19 vaccine, already have their booster dose. Today, at least 4,500,000 people has coverage with the booster. How can see here, Chile has had 87 consecutive days of failing COVID-19 case. Contagion are the lowest levels in April 29, 2020. Weekly ICU admission for COVID-19 are the lowest level since they have been registered more or less April 14, 2020. Daily death COVID from 19 fell to the lower level since May 21, 2020. And in addition, Chile showed one of the lowest mortality in South America during the pandemics, and death from COVID-19 decreased 91% since the last peak, and ex-mortality fall to pre-pandemic level. You can see in the rise graph. But in addition, the epidemic has made more visible how social determinants such as poverty, overcrowding, unregulated immigration, and many times subject to abuse made the epidemic have a different expression depending on the affected area. The social protection network contemplates more than the 27 billion in social assistance to Chilean families between March 2020 and September 2021. And according to the IMF, Chile is the 11th country in the world that has spent the most on social assistance during the COVID-19 pandemic. And in addition, the economic and social measures have mitigated the impact of the pandemic on poverty in Chile. Fortunately, how you can see here, the different level, the poor population has increased little bit in the case of the Chile. And the Delta variant has begun to circulate in our country. However, its behavior so far has been less aggressive in terms of infection than in other latitudes. Among other things, because a high percentage of the vaccination population was found. And even Chile has maintained the speed of the vaccination by extending coverage to minors. And this trend contrasts with the evidence worldwide, where lower level vaccination are observed in recent weeks. And in summary, the central axe of the strategy tackled by Chile to face the pandemic has been, first, increased attention and testing capacity, and increase the capability, avoiding the drama of the last bed. Second, dynamic confinement, mitigating the unwanted effect of quarantines. Third, plan for the early purchase of vaccine and a quasi-universal vaccination program today. Four, early initiation to booster vaccination. And five, social aid of magnitude. In addition, I agree with Denise in order to recognize the advantage in the public collaboration, the introduce of the university in the study, in the research, in the increase for example, for the study, the new cepas on the new capability in order to other laboratory. And I agree that with Dennis also in relation with unfortunately, the problem has been during the pandemic with the fake news that we need to continue working in order to give clear information to the population. That's it. Thank you very much, Noel.
Thank you very much, Emilio. Very comprehensive presentation, and very interesting that the case of Chile has a combination of incredible success stories when we talk about the early rollout of vaccination, when we talk about the high testing rates, but also some of the same problems that I think all of our countries are facing in terms of the debate over when to introduce boosters, the problem of a decline in vaccination rates, the real issue of socio-economic impacts. And as you mentioned at the completion of your remarks, the problem of misinformation or fake news. So now let's move to the third speaker, who will be giving us an impression of developments over the past year in Uruguay. José Pedro Arcos is a member of the National Academy of Medicine of Uruguay and a member of the Scientific Advisory Group to the President on the government's approach to COVID-19. José, the floor is yours.
Hello, thank you, Noel, for this kind invitation. I'm going to share my screen. Is it okay?
Yes, fine.
Well, last year, as November 2020, we were in a very good position, having very few cases of COVID and very few deaths compared with our neighbors. And that made us very happy. And we had this time from March to November to prepare the country for the pandemic. This is what we call the first of three phases. The first phase with controlled pandemic using the strategy of testing, tracing and isolation could be held until December or January. Was this an accident, or was this the result of what we did? We are a country with less than 5 million people and low population density. We have a single harbor, a single airport. We have very few massive events, except from those corresponding to football. And that could be one of the causes. Or on the other hand, we have a very strong national health system, 12 years now in place. And we did really a lot of health policies and restriction measures like widespread testing and the intensive contact tracing system. These are summarized here. Here in blue is the declared health state of emergency, how we suspended flights and traveling. Here in green is how the academic institution turned it into diagnostic center and how we could have available the molecular test PCR since the beginning of the epidemic, thanks to this conversion of academic labs into assistance centers. The government heard us, and we formed a scientific advisory group that was monitoring the pandemic continuously. The second, or one of the major factors was that we reduced the mobility during March and April. In March, we have received the first cases, and it was really effective during some months, returning slowly to the normal until November. So we think that this trend in community mobility helped to have this control phase of the pandemic. But we are not an island. We are a wedge country between Brazil and Argentina. And the variants of the virus developed, like in other countries, in a particular way. We have our own variant that is graphed here. Initially, we have the Brazilian variant, originally originated in Brazil. And finally, the P1, now called Gamma variant, was the one that takes 80% of the cases. So this is another major factor to enter the second phase, as we called, or uncontrolled exponential growth of the pandemic. The mobility was returning to normal, as we didn't expect that, but people started to gather and to travel, and the summer season has had its effect. Our data group was very good doing this study that could predict the tendency of the number R, very well correlated, as this number shows, with the mobility index. Every time there was an event or any social event that could gather people, it was followed 18 days later with an outbreak of COVID. It was very exactly these two lines are well in phase when we take into account these 18 days. So we can predict every outbreak of COVID, the months that were really strong in community transmission. And this second phase started early in February. We analyzed the transmission level within common indicators and the response capacity of our health system, mostly by the amount of ICU beds that we had. And we concluded that we were, on February, at the community transmission level number 3 for WHO, and our response capacity was also 3. How was possible not to progress to the 4 level of transmission? Well, we made specific recommendations. There was a need to improve communication with the people that was forgetting about the new behavior. And it was also needed to improve testing and tracing, but when we passed our 1,000 cases per day, that was not useful. We need to improve the health care of the non-COVID diseases, and physical distancing in all the environments and the reduced mobility should be imposed. Well, the government took some of these recommendations, but not all. And then we entered it fully in this exponential growth that made us similar, very similar, or approach us to our neighbor countries. This is death per million people that we know is the parameter, the most rough parameter, but one of the better. Now in the third phase, we have no more cumulative or increase of these cumulative deaths. These deaths were not due to the lack of beds. This is the peak of the end of May. There was a worst peak. And at that time, the total bed occupancy was always less than 80% or 85%. That stressed the system, but there was never lack of beds. We were able to increase our ICU bed from 600 to more than 1,000, and the ventilator capacity doubled during the first phase of the epidemic. Was there an excess of death? We think that there was. It's a very difficult parameter to calculate. We need more information of the last quarter, but this 8% of excess of death from all causes that, well, we think it represents that it's really an excess of deaths even for a country like us, and that perhaps this could be prevented if all the recommendations were followed. We enter then in the third phase, a phase of controlled pandemia, again with vaccination, in difference with the first phase. The drop of cases was sharp once we started vaccination in March. That rapidly grew up very, very easily in our country. The government made everything or decided that this was the race to run. Vaccine against community transmission. Well, perhaps if vaccination had started 2 months earlier, we could have saved many people. Uruguay signed the COVAX facility of WHO and PAHO to acquire the vaccination, but didn't work. That was last month of last year and didn't work. Then we finally ended acquiring vaccines, half of them from Sinovac and the other half from Pfizer and AstraZeneca. But I had to remember what the WHO director said in January of this year, saying that we are confronting a catastrophic moral failure in what is the distribution or the inhomogeneous distribution of vaccines. Now we are very good in percentage of people fully vaccinated with some of our neighbors and other countries, but for us it was very easy. We are very few. We have a goal of something like 2 million and something vaccines that we are going to reach very soon. The social and economic impact in our country is not to be disregarded. The GDP reduced like something like 11% and has not returned to normal as Chile, Paraguay, and perhaps Brazil are going to do. And then people unemployed increased. This is applications for unemployment insurance that reflect how many people lost their jobs during the worst months of this and last year. Now the numbers are reaching what is a 10% of unoccupancy in our country. We did a lot of things in measures designed to protect people, and we are in the group of countries that helped the income support with something around 50% of the salary. We expand the unemployment insurance, we defer payment and taxes. The subsidy was for many people, including older people, and many other measures, but we think that we could have done better in these terms. Some positive lessons that we learned. The initial decisions of this pandemic were taken by the political system following the scientific advice, and this is something to be remarked. The test availability were rapidly developed, and we were independent in these terms. The information was central, was coordinated, and was transparent. Everybody has this app in their phone where you can have all the information and graphs like this that show how where is our green, red, or yellow color. And we have a high rate of adherence to the vaccination assist tradition in our country. Negative lessons of this year. Well, we have excess deaths. We have a severe delay in diagnosis, especially in cancer and cardiovascular diseases, that we are going to calibrate and measure next year. But here we know that people have not done all the controls necessary to diagnose these diseases. We are dealing with long COVID and the pulmonary sequelae of the persistent post-COVID. We have a lot of vulnerable populations that have suffered, like low-wage workers, and especially the elderly portion of our old people that is living in long-term care facilities, and where the mortality was very high. And there is also the shadow pandemic with consequences of the domestic isolation that has augmented the gender-based violence and other situations like this. And there will be an educational gap, especially for the more vulnerable. The new normalcy is a great question. We know that it is a social construct. We don't know if the people will follow using the mask next year or next winter, and we will see less common infections of the respiratory tract as we see these years using the mask. There is no vaccine mandate, although there was a tradition in our country. The government did not impose a new mandate, but suggested that everybody must be vaccinated, and suggested that private parties will take resolution of letting people in with the vaccines or not. We gained a recognition of the science. People for the first time have seen that scientists could collaborate in a very practical manner, saving lives, saving lives. The health system gained in confidence, increased the trust of the people, and maybe that we finally recognize the concept of one health, meaning that the environment, the animals, and humans are suffering together, as happened with this special disease. The booster doses of vaccines started to be administered. That was very fast in September, and old people and comorbid people has it readily available. So we hope this will reach the herd immunity in very soon. Well, this is my summary. Thank you very much. I'll be happy to take questions later.
Thanks, Jose, again for a tremendously comprehensive presentation. I like the fact that you very candidly acknowledge some of the problems as well, and I hope in the Q&A session, which we're about to start now, we'll be able to tease out some of those, in particular the excessive deaths, the dilemma about distribution of vaccines globally, and as each of the speakers have mentioned, how to deal with the economic impacts of the COVID pandemic. So now we turn to the final section of the webinar, which is the the question and answer session. This will be moderated by my colleague, Luis Salvador Carulla, the head of the Centre for Mental Health Research at the Australian National University. In fact, the initial series of webinars was essentially the brainchild of Luis. It followed his initiative to have a similar series which looked at the experience of European countries in dealing with COVID. So let me pass the floor to you, Luis, and let me remind all participants to please use the chat function to flag any questions you would like to put to our speakers. Over to you, Luis.
Thank you. Thank you, Noel. I think about this in relation to the previous series, webinar series, this new webinar was absolutely essential. And that was the major feed by Noel to get us together again in this session. What we have heard provides a very clear idea of the importance of looking at world regions and understanding what is happening in COVID in a series of countries that could be analyzed and compared together. And this brings key aspects related to, for instance, the importance of boosters. That's a critical question for Australia right now. The importance of the strength of a public healthcare system. That is one characteristic common to the three countries. The issues of the relationship between public and private care. The differences in the response to different vaccines and the incredible work carried out in Chile in this aspect. And other components like the problems of the social impact and the impact on the Gini index apart from the GDP, as was mentioned by Denise. I would like to open this Q&A with a question for the three of you on the PAHO WHO role in the pandemics. And this is related to Jose's comment on the initial vaccine program developed by PAHO and the need to take a more active role at the country level. What do you think about this role in comparison to the previous pandemics? And I will start by Jose.
Well, thank you, Luis. I can say most of vaccines in Uruguay are acquired by the PAHO rotative fund. Usually most of them, all the common vaccines are always acquired through the PAHO and has worked very well during many years. We were one of the first countries to sign this COVAX facility, and we were always hoping that it would work, but I really don't know why it didn't work. And we didn't receive almost any vaccine from that source, and finally ended with a commercial transactions that the government directed and was successful, perhaps a little late, but I cannot answer why this was not done as with other vaccines had always been done.
Thank you. Emilio, do you have any comment on that?
Yes, Luis, thanks. I think that we need to see it for the futures because I think that everybody knows that in the future we have again other kind of the virus. And I think that's we need to prepare all together in LATAM. I miss that, of course, PAHO works in relation with the vaccine campaign with the common fund. But in addition to this initiative, I miss that everybody work together, for example, in very, very trouble that other countries have. Oxygen, for example, Peru have a huge problem with the oxygen, and includes some place in Brazil, and mechanical ventilator, and in addition to the vaccine. So I think that's everybody work together, have the capacity to develop for the future this kind of the logistic, because we can forget that some kind of the plane that come in this area with the ventilator don't arrive with that. So what's the matter? I absolutely convinced that we have the capacity to provide everybody between us this kind of the device and oxygen, of course. So that is the first lesson. The second lesson, in addition to the word of the PAHO, is the knowledge about the research. The third lesson is, of course, how we provide the vaccine for the region. For example, Chile today have a huge agenda with the university in order to establish here in Chile development of the vaccine. How we think together this kind of the strategy. And the fourth key for the future is how we manage the information, the data, how we work with the predictive model, with the proposal to identify and recognize how it works and what matters in this area, in this country, all together. So there, I think that we have for the future huge challenge, and the future is work everybody together.
Thank you, Emilio. And Denise, any comment on the role of WHO or PAHO in Brazil?
We have very turbulent moments in Brazil because the political, we had 4 ministries of health in 1 year, different ministry of health, and for some months, no ministry of health at all. And every change the how they see the policy and how they have relationship with PAHO. At the beginning, our president was against PAHOs, and the first choice of Brazil was to make the purchase directly with Sinovac and AstraZeneca. Our government, federal government, wanted to produce only AstraZeneca and not Sinovac. Sinovac was from the state of São Paulo, and that there was a dispute between both, and then they started to say those vaccine is not good, and it started to have a political dispute. And then the both contracts was to technology transfer, and then Brazil started to produce this vaccine here, and now they are able to, especially to sell these vaccines to other countries too. And only when it was a delay to receive the active pharmaceutical ingredients, the Brazilian government asked for COVAX vaccine, but I don't know if it's about delay or the quantity was not enough. But after the agent, pharmaceutical active agent started to come, Brazilians started to produce here. And the image of WHO in Brazil varied too much. There are some governments that endorse and scientists endorse WHO recommendations, but it's very heterogeneous attitude. We cannot say that it's a predominant view. And each state has a different view of the problem and started to do something different. It's like that.
Thank you, Denise. And I think we have this question of what is the role of the international organizations in supporting local, regional, and and national policies. And there are several questions related to the issues related to policy and politics that you were raising some of these in your comment. One key question related to what you were mentioning is not only the impact politics and policy had in COVID, but what are also the impact of COVID in policy and politics. And there is one question about your opinion on what's going to happen in Brazil. What will be the impact of the political influence on COVID in the election?
Nobody knows. Nobody knows. Next year is the election for president. And whatever our president can do, he has 25% of vote. This is the minimum of what they have, whatever he does. At the beginning of the government, he had, I think, 35% maybe of support from the public, general public. But I think that especially in the second wave, when several people started to die very fast, and the decline of economics, it was very visible to people, then many people was completely discouraged from our president. And there is another point that his popularity was increasing last year, especially because he provided the social benefit, and it was a good measure for the most of population. It was over 65 million people under very difficult situation. But he cut this benefit on November last year. And then from November to April, they received nothing. And then it started the second wave and everybody was dying. And when he started the benefit, then it was very small amount of money. And the inflation now jumped from 3.5% to 8.5%. And then people cannot buy food anymore, cannot pay electricity anymore. And this impacts too much his popularity now. But we are not able to predict what is going to happen next year, because the Lula was held in prison until last year, and he was free now, and he intends to be the second option for president. And there are a lot of people don't accept that yet, and a lot of people don't accept Bolsonaro also. And then we don't know exactly what are going to be next year. But his popularity decreases, but not too much that we can say he's completely rolled out of election. We cannot say that. It's impossible to say.
Thank you, Denise. So we have three very different experiences in the relationship between academia, science evidence, and policy making. We know, and you have explained all the situation in Brazil. You, Jose, were, and you said that in the previous webinar, how close was the relationship between the government and the expert advisory committee. And now you explained that there was a period where this didn't happen, that the government was not following the recommendations of the expert advisory committee. Can you extend this comment and explain us something about this?
Yes.
I think, sorry, it was not for me.
No, sorry, it's for Jose. Sorry.
Oh, sorry.
Yes, we have to recognize that on April 16th, 2020, the government asked to form an advisory group and follow the recommendations very closely. And there was a relationship that we have never had with any government as before. This ran very smoothly and well during 2020, and we could work efficiently. And the slogan and the concept of the government and the president particularly was responsible freedom. Ask for the people to be responsible, but let them be free. That was used as a slogan. And when we arrived to February and March, we expected some restraint from the government that could be enforced. And the government continued with the slogan, responsible freedom, because at that moment didn't want to shut anything else. And the partial lockdown that we had at that time could be extended, but it wasn't. Perhaps favoring the economic recovery and expecting that vaccines could protect the population in a very fast evolution. That wasn't the case. We had 6,000 deaths that we think that's an excess. But well, finally, the pandemic was controlled following the vaccination. And we had two phases to recognize that the first phase was very good and they heard us, but when the bad times arrived, the government decided to not follow all the recommendations that we did. That is very difficult, you know. Now the president still has a good approval in polls at least, but he has to deal with unemployment that increased severely and still remains in high numbers.
Thank you, Jose. I just see that the ambassador of Uruguay is recognizing your contribution, and I would like to thank all the ambassadors and diplomatics who are attending this webinar. It's a very good output of this. And she's also talking about the role of, or your comments on violence and the problems related to social unrest. And do you have any further comment on other policies trying to cope with these issues in Uruguay?
Well, violence is a long-standing problem in our country that has been addressed in many ways. And although there have been improvements in many indexes, what we think is that the social confinement has had its impact, especially in gender-related violence and domestic violence due to the stay-home policy mandate. I don't have the numbers readily here, but it's a long-standing problem that has to be addressed and improved.
Thank you. And I see that Daniel Gaspari has raised his hand. So please, if you would like to make a question. In any other case, remember that we have the chat open for questions.
Yes, I was willing to turn on the video, but I think that the maybe Noel, can you please activate the video, please, if it's possible? It's better for people to to see me. Thank you so much. I'm the head of mission of the Venezuelan Embassy in Australia, and certainly I appreciate a lot the efforts that ANCLAS does in order to put this in place. And I would like to recognize the efforts done by Jose from Uruguay and Denise from Brazil and Emilio from Chile. And I will bring into the floor the possibility of, for the next forums, to bring some experiences from other countries like Argentina, which is, I think, an important experience. Why not Cuba, which they developed, I think the first vaccine in the region was developed by Cuba, and they seem to have very good experiences. And of course, other countries from the region. I think that will be my proposal. And I won't finish without giving thanks to Luis. Thank you for the words, and to recognize the job that ANCLAS does in order to give us all this nice information, which is very important for our country. Thank you so much.
Thank you, Daniel. This webinar is focusing on South America. As I don't know if we will be able to run another one in Central and North America in our next in a tentative other webinar. We will see. And thank you for your words. And we were talking about this impact on social aspects, and a very interesting case is Chile, where there was a level of social unrest before COVID. There has been a series of policies trying to reduce the social impact of the pandemics. And I think it was Jose who showed the levels of recovery of the GDP, showing that Chile is the country that's doing better in South America. Would you like to make some comments on what is this situation there?
Yes, of course. Thank you, Luis. Of course, Chile early identified that the problem is not the pandemic. The problem is the syndemic. That means that we are in front of the sanitary, social, economic, and mental problem. In order to avoid the consequence of each one of them, was necessary the sanitary strategy that we commented before, but in addition, the social and economic impact. That's the reason why Chile implement a very strong strategy in order to economics coverage for the population, and especially with the focus on the vulnerable population. And other issue that's is very, very important in special now, how you name it, the third weight, the weight of chronic disease and the mental disease, how we establish a new strategy for the future in order to ask the ambassador from Uruguay, the problem with the mental health. There we have a problem in Chile, and especially because the union of the teachers avoid to reestablish early the school. So when include the wage is decreasing, the union of the teacher that has very strong left position antepose your place. They don't think from the kid. That was very, very, very important problem. Include today, when our results are very, very fine, there are some places where the kids are not go to school. And I mean, there are very, very important evidence that show that the send the kid to the school. Of course, when disappear the peak of the wage, is one very strong strategy in order to avoid the mental health. So that is one of the lessons that we need to establish here. We need to identify the difference between the policy and the politics. Of course, when we are thinking and we are talking about the pandemic or syndemic, we need to establish the best practice and we need to think about the people. So we need to establish the policy. Unfortunately, our region have now very, very problem with us, in especial with the left sector are trying to establish populism. that is probably one of the dangers that we have in the future, because the poor, of course, will increase secondary to the pandemic. And in this case, we need to establish the structural change in order to recover very fast the level, the social and economic level. But anyway, if it appears that discard the populism, it's very, very dangerous for our region.
Thank you, Emilio. And you mentioned mental health. We had a specific webinar on this topic in our previous series. And as we have Denise, who is professor of psychiatry and also in health economics, I would like to finish this session of Q&A with a comment by her on this situation in Brazil.
I don't have numbers yet, but what we see with, especially about school, the children and adolescents suffer a lot with the stay-home policy, and also the private schools has capacity to have online course and to have to give support, but it was not the same with public schools, because the majority of people, the poor people especially, don't have internet access, and the parents have low education and don't provide enough support, and many of them was out of school. Now they opened the schools and everything is presential now from August, exactly because mental health of children and adolescents was worsening too much. And there are some reports talking about increasing the number of suicide about the youngest. I don't have the numbers here. Also, now they are in presential because that, and before that they started to vaccinate professors, teachers, etc. before starting to open all schools. And now they are vaccinating adolescents too. I don't know about the figures of adolescents and young about mental health, but we have reports that they are suffering a lot. And mental health problems are growing in all ages, especially we have some studies being conducted. Especially we have increase on the number of symptoms, psychiatric symptoms, anxiety, depression, etc. But about the mental disorders, we don't have conclusive studies yet. We are ongoing studies yet to know about mental health. And this is a very big problem here.
Thank you. Thank you very much, Denise. Thank you, Emilio and Jose. It has been an incredible session, and I will let the floor to my colleague Gisselle Gallego to wrap up and conclude this webinar. Please, Gisselle.
Thank you very much. Once again, I want to echo everyone's comments about what a wonderful job Denise, Emilio, and Jose did. I'm just going to basically summarize a couple of the things that I picked up from their presentations. The first thing, especially that it's apparent from Brazil and Uruguay, is the changes between the first wave and the second wave. I thought it was quite particular from Jose, what he showed how well they were doing in 2020. They thought they were like, oh, we're riding this wave, we're doing really well. And then the second wave came and everything just almost came crashing. So you can never, it shows how the pandemic can easily change and the situation in the country. For Brazil is also the changes in terms of mortality, how the first wave obviously had interesting, like a lower mortality versus the second wave had a higher mortality, especially amongst younger people. So that was quite remarkable. Obviously, the impact of vaccination on mortality and the healthcare system, we all know that, but it's great to see the graphs when, particularly Brazil, when you show the shock wave when once vaccination kicks in, you allow the healthcare system to breathe because there's a lower mortality, and it's seen in other countries. So it always highlights the importance of vaccination. In that same sense, the pre-purchase of vaccines, as in first in best dress, I will say, and Chile in getting there early. I would say there has been a failure of PAHO and COVAX, and that has happened around Latin America, and we're still, as I'm doing research in terms of vaccination access, what I've seen is there's a lot of vaccines sitting in places waiting for regulatory approval, for example, or paperwork and a lot of red tape. So that is something of a failure in terms of COVAX. Interesting to see the local production of vaccines in Brazil and how that obviously provides access, and keen to see what happens with their own vaccine. As someone highlighted in the previous seminar, the Soberana 1 and 2 in Cuba has already gone clinical trials. I'm looking forward to hearing more about the Brazilian vaccine. Obviously, the importance of high vaccination rates, very impressive that Chile is the 6th in the world. Also high vaccination rate from Uruguay, high vaccination rate for Brazil. And I think something that I picked up from Jose that was really, really important, and is that moral failure. Now we're really in this together. So unless everyone gets vaccinated around the world, it's not just I am a success as a country, but it's how we all provide access to vaccines. It's always going to fail because, you know, the virus, as we know, travels, the borders are not hard, and we can't live in lockdown all our lives. So we definitely need to support access to vaccines around the world to make it better for all of us. So it's not just about a country specific. Again, the integration of public versus private in Chile, but also the contrast of the public sector in Brazil being stronger than the private sector. So you never know how they will work. Also in Brazil, that lack of coordination of vaccines, supplies, and the health and economic policies also seen. I am speaking from Bolivia, from La Paz. Same problem in Colombia, especially with coordination of vaccines, where there's been delays between doses because you never know what you're going to get. So it's not unique to the Brazilian example. And we already know the rising inequalities, and of course the importance of social assistance was highlighted by Chile and Uruguay, but this is going to be a long term. There's more people pushed over the poverty line, and that's really what's going to impact in the long term. You know, everywhere suffering from fake news, but as I say now, I think epidemiologists are starting to look very sexy now because science is now part of the social discourse. We, you know, people talk about science in different ways. So there is a positive aspect in terms of science being at the forefront. And for example, in Uruguay, where scientists are part of the decision-making process. And the hard things, and not only in Brazil and Uruguay, about social distancing and reducing mobility, it's still a challenge. Once again, I mean, in you know, our experience here in Bolivia and in Colombia, you know, we are in what's called a recess week in Colombia, and everyone's out and about traveling. How do you stop people from moving, from partying, from living life is quite hard. Also, you know, the importance of increasing lab capacities. Once again, Chile is the highest in Latin America, but Uruguay was very, from the beginning, had high level capacity just of testing. So that's really important. The importance, once again, of scientific advice, the information, and I thought it was very nice about the Uruguayan app. I think that's wonderful that you have information in your hands. And very important, as once again highlighted by Jose, is that shadow pandemic. It's people delaying seeking care, the impact of screening, chronic conditions, domestic violence, and what's going to happen in terms of education. And once again, it's not only in Brazil. I'm doing some research here in Bolivia that shows that, interesting enough, public schools are now doing face-to-face versus private schools that have decided, based on parents not wanting to send their kids to school, doing still online learning. So it will be interesting to see the impact of education outcomes. Long-term effects of people recovering from COVID-19, as was highlighted. And once again, what's the impact on mental health, especially for children and young adults? How does the new normalcy will look like as we see people struggle with the social distance, people struggle to keep using face masks. So how's it gonna look like? And once again, highlighted the policy versus the politics. There is definitely a thing about the politics of COVID-19, the pandemic, and that is seen not only in Latin America, but everywhere else around the world. And that's all I had to say in terms of my closing remarks. And of course, once again, thank Denise, Emilio, and Jose for wonderful presentations inside and show us how, you know, there's still strengths, there are positives, there are some negatives, but there are some positives. And for me, the great thing to see is those beautiful graphs when you see once people are vaccinated, the mortality rate goes down. And I do hope that we do raise the issues around inequities and what's going to happen in the long term as less people, more people reach the poverty line. So thank you very much.
Thanks very much, Gisselle. And I think that's a very good note on which to end our webinar today. In closing, let me thank our three guest speakers from Brazil, Chile, and Uruguay. Let me thank my co-hosts, Gisselle and Luis, and also Claire Palmer, who has been responsible for making sure that the logistics worked fine. Many people ask me, why Latin America? And I think the record that we've heard from the three speakers today more than answers that question. Latin America's experience can be helpful to every country, both its positives and its negatives. I think it's been really important for us to be honest and candid about the results that we have in our respective countries. But equally, it has been tremendously positive to share the lessons learned as we look ahead to what we euphemistically call the new normal. So thank you all very much once again. Thank you for those who registered and observed the webinar. And we look forward to hosting more webinars on themes of policy interest to Latin America and Australia in the future. Thank you.